Hi, my name is Andrés Espinosa Torres, and I'm going to talk about approaches to catheterization for persistent atrial fibrillation. Definition. Percutaneous catheterization is an effective treatment for proximal atrial fibrillation, particularly in cases that are refractory to antiarrhythmic medication. Most triggers for proximal atrial fibrillation come from the pulmonary veins, so ablation involves treating circumferential lesion around the veins to electrically isolate it from the rest of the left atrium. Application in mice. Catheter ablation for persistent atrial fibrillation is more challenging and is associated with less favorable outcomes. To improve outcomes, ablation targeting the substrate that maintains fibrillation is often aided to pulmonary vein isolation. The two most common techniques for substrate modification are the creation of linear lesion in the left atrium and focal ablation to eliminate atrial signal that show complex activity, sometimes called complex fraction electrons. Pros and cons. Pros. Data from randomized trials comparing methods of ablation for persistent atrial fibrillation are limited. Despite the positive data guidelines suggest that operators should consider more extensive ablation based on linear lesions or complex fractional electrons for ablation of persistent atrial fibrillation. Cons. Whether more extensive ablation improves outcome is unclear. Therefore, this trial compared three approaches to ablation for persistent atrial fibrillation: ablation with pulmonary vein isolation alone, pulmonary vein isolation plus ablation of complex fractional electrons, and pulmonary vein isolation plus linear ablation. Issue of lead in Ecuador. 80 patients were recruited with a diagnostic of atrial fibrillation and document in the clinical history. Of the 80 patients studied, taking into account the four types of atrial fibrillation, it was observed in the type of permanent atrial fibrillation with a frequency 35 patients, paroxysmal atrial fibrillation, 16 patients, persistent atrial fibrillation, 13 patients, initial atrial fibrillation, 11 patients. Conclusion. Among patients with persistent atrial fibrillation, we found no reduction in the rate of recurrent atrial fibrillation when either linear ablation or ablation of complex fractional electron was performed in addition to pulmonary vein isolation.